Disclaimer: I am not a mental health professional. This video is an academic exploration of an unsettling question: the overlap between mental health and alleged demonic possession. This is not medical advice. If you or someone you love is struggling, please seek a qualified professional before drawing conclusions. Tonight on Dr. Nightmare, we're exploring the fraught intersection between psychiatry and the paranormal. When do disturbing symptoms point to a brain disorder? And when do people say they point to a demon? We'll look at academic research, cultural interpretations, and chilling real-world case studies that continue to blur the line. For centuries, cultures explained extreme behaviors, voices, convulsions, sudden personality shifts through spirit possession. As modern medicine developed, many of those same behaviors were reinterpreted as neurological or psychiatric disorders. But the interpretation a community gives their symptoms matters profoundly for how people seek help. In her 2013 paper, psychologist Jean Mercer examined Pentecostal deliverance practices, rituals meant to expel demons thought to cause everything from schizophrenia to ADHD. In that worldview, demons gain entry through trauma, curses, occult activity, or even family sin. Deliverance ministers sometimes reject medical care or require spiritual congruence before accepting it, creating ethical and clinical dilemmas for professionals. Mercer warns, if a patient believes their problem is spiritual, standard treatments may be refused, and that refusal can endanger recovery. A 2021 three-wave analysis of the National Study of Youth and Religion offered a chilling data point. Among young adults, belief in demons was one of the strongest predictors of later declines in mental health. The cross-lagged model suggested the effect ran mostly one way: belief in demons led to poorer mental health over time. In other words, sometimes the very belief in possession worsens the suffering it tries to explain. Other research, like Somasundaram's 2014 review of possession in South Asia, shows how symptoms we'd call dissociation in the West are integrated into cultural rituals elsewhere. Similarly, Dein's 2017 work in mental health, religion, culture argues that psychiatric symptoms and possession states often overlap, making the line between illness and the supernatural almost impossible to cleanly draw. Then there's Dr. Richard Gallagher, a psychiatrist who documented 25 years of cases in demonic foes. Gallagher started as a skeptic. Over time, he encountered a handful of cases he says defied psychiatric explanation: sudden fluency in unknown languages, hidden knowledge, dramatic shifts after occult exposure. He argues the vast majority are medical, but a small subset resist naturalistic accounts. Gallagher's stance is controversial in psychiatry, but his clinical training and careful case descriptions force us to ask, how do we distinguish rare, baffling phenomena from pathology? Cases like Anneliese Michel, the real story behind the Exorcism of Emily Rose, haunt this discussion. Diagnosed with temporal lobe epilepsy, Michel later reported visions, voices, and behaviors her family saw as possession. Between 1975 and 1976, priests performed 67 exorcisms. She died of malnutrition at age 23. Doctors insisted her illness was neurological and psychiatric. Her family believed otherwise. Her case became a courtroom battle between medicine and faith. Father Gary Thomas, trained as an exorcist in Rome, tells similar stories. In some cases, psychiatrists identified schizophrenia, not possession. But in others, he describes inexplicable phenomena, strength beyond normal limits, or sudden unknown languages. His testimony reminds us that in rare cases, even collaboration between clergy and clinicians leaves disturbing questions unanswered. Voice, measured, factual. The result is a moral minefield. Clinicians must rule out medical causes, infections, seizure disorders, substance effects, psychosis before any spiritual framing. Yet they must also respect patients' beliefs to build trust. Jean Mercer emphasizes the ethical dangers, rejecting medicine outright or forcing spiritual cures on vulnerable people. If you're worried about someone, first get medical help. Insist on a medical and psychiatric evaluation. Ask about labs, EEG, or scans if needed. Second, don't shame spiritual beliefs. If faith is central, seek clinicians who can collaborate respectfully with religious leaders. Third, if there's danger, self-harm, refusal of treatment, or violent episodes, call emergency services. Safety comes first. My recommendation: always seek natural explanations before jumping to the supernatural. Exhaust medical and psychiatric routes. Only if those are ruled out should other possibilities be entertained. Most of the time, troubling symptoms have natural explanations, but the boundary between mind and meaning is messy and sometimes terrifying. If you're searching for answers, don't rely on videos alone. Seek professionals, pursue assessments, and treat the person in front of you with both scientific rigor and human compassion. Because whether the horror is in the brain or in something else, untreated suffering is real, treat it, respect it, and above all, stay safe.